Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callendar.
Yeah.
Because some people think that it's all related to diet. When in point of fact, as you go through this article, you see that sometimes diet has nothing to do with it.
Oh,
I hate this picture though.
Bacon.
you hate it?
I'm lying. You know I'm lying.
No.
Right.
One of your loves, isn't it?
I love
What is this?
Bacon!
What is it? Is that, I guess that's bacon. Oh my
Yes,
goodness.
oh, yeah.
bacon.
Love it.
That's Buchanan's favorite, isn't it?
Oh man.
Well, yeah, you can have too much good thing. My wife was trying some bacon substitutes, boy, and the vegetarian substitutes, boy, tastes like paper. Yeah, Dal, you ever use any of those substitutes?
Oh, no.
Hmm.
Used to-
Wisely.
they taste-
How about exchanging it for like turkey bacon or beef bacon?
Well, it depends. Turkey bacon causes no problems anyway. So, yeah, you
Oh.
can do that, but it's just that for her, it doesn't work.
Oh,
And she tried the vegetarian, and that was really awful.
oh my gosh.
It's like paper.
Oh.
How about the Beyond Meat?
What's that?
How about the Beyond Meat?
What is that?
Some kind of meat substitute. I really don't know. I just hear them talking about it.
Oh, okay. She got it. She got a substitute, but it was, I don't know what the name of it is, but it was horrible. She let me taste it.
Yeah, the Beyond Foods are tastier. They make hamburgers, sausage, and they're fairly tasty, but they're high calorie, high salt, so I don't eat them either.
Mm.
Oh my goodness.
Now, the number 2 identifies the difference between the two cholesterols, the HDL, which is good for you, and the LDL, which is not.
Mhm.
And then it goes on to talk about the fact that there's some people who just have hypercholesterolemia genetically,
Right.
and their diet has got nothing to do with it. And they have to take medication. And these are the people who get early heart attacks. And we had a colleague of mine who's a pulmonologist who had a cardiac arrest at home because of the hypercholesterolemia. And he was resuscitated and is doing well now.
Oh.
But he had to be medicated for the hypercholesterolemia, which was genetic.
Mhm.
And most people will try diet first and try to decrease cholesterol and exercise and the other things you can do.
Yeah, absolutely.
But then if those don't work, then medication becomes essential. And that's what this indicates. But that's part of the blood work that you should be getting annually to see whether your cholesterol is up or not, which one it is. The HDL is supposed to be protective, and the LDL is supposed to cause coronary artery disease. Interesting, they say most heart disease is preventable, and we often don't talk about some of the causes of heart disease like alcohol, which causes a special heart disease. But the bottom line, you see that last sentence. With healthy high lifestyle, most heart disease can be prevented. So that's the moral of the story. But if you have some of these issues that are corrected early, then you can prevent from having heart disease. So I was just asking about you, Cheryl. Welcome.
Thank you. Yes, I'm here.
Oh, good.
Hi,
Good.
Cheryl.
Morning.
Welcome. Good morning.
Hi, Cheryl.
Morning.
Good morning.
Good morning.
Bonnie is here. Bonnie is here.
Oh, hello, Bonnie. How are you?
Good.
Just
Hi.
fine. How are you?
Good. Good to see you. Again, I missed you. Anybody have any other questions about classroom? If not, this is an article that I thought would be of interest because sometimes we take medications and we don't know that they have side effects. And one of them can be depression and suicidal ideation.
Whew.
And so it's important when you have some mood changes after taking medicine that it may not only be you, it may be the medication that you're on. And this article enumerates some of the medications that have depression as a side effect. Let me ask a question to see how smart you guys are.
Uh-oh.
Which location has the lowest suicide rate in the United States?
Hawaii.
Any other guesses?
Can you give us a multiple choice?
No. No. Yeah.
What places have the lowest
Which
Lois.
is the lowest in the country?
state?
State.
Whatever you want to call it, whatever state, yeah, whatever state, yeah.
You said in the
No.
country or in the U.S.?
United States.
Oh, I don't know. Utah.
I would say Florida.
And the answer is the
Maine.
District of Columbia.
Oh,
Really?
Eddie, you're right.
Wow.
And we have the highest incidence of end-stage renal disease, and we have the lowest incidence of suicide.
Dr. Callendar, my husband just said, I told you to say Washington, D.C., and I didn't say it.
That means we're supposed to obey our husbands?
Whoa.
That's right.
Yes.
That's it.
Yes.
Oh, shoot.
Yeah, we
Yeah,
should
it's too
obey
bad you
our
ladies
husbands.
don't remember that. Yes. Washington, D.C., 7.5,
Washington, D.C.
the
Wow.
lowest in the country. I was surprised to see that.
I'm surprised.
Yeah. You remember there were times we used to say, black folks don't kill themselves.
Right.
Of course, we try to do everything that the other brothers do. And so we may be catching up. But right now, number one in the country, the lowest rate of suicide is Washington, D.C. Probably because more people have jobs and so forth. Perhaps, I don't know.
Even
this-
that fits the people in the White House too?
No comment on that one.
They're not Washingtonians.
Most of them. All right.
Yeah, they need to go back to where they are from.
By the way, this is one of the commonest problems with patients who had hepatitis C. The medication that they were given was interferon, and it had a high incidence of depression and suicidal ideation. And that's one of the reasons why the new medication has made a tremendous difference, because that medication isn't the same as this one. Now this is a medication for those of us who are going bald,
Uh-oh.
Oh,
and it has a side effect of depression as well.
Does that have anything to do with pulling your hair out, guy?
No, no, it's for those who want to have their hair restored.
Oh, okay.
Rogaine and
Oh.
the hair transplant stuff.
Mm.
Yeah, but actually, it is a side effect. Then, of course, the anti-epileptic drugs, some of them, it doesn't have the Dilantin, which is the commonest one,
yeah.
but it has the other ones, the more modern ones. But and depression is thought to be one of the commonest reasons for suicide.
Mhm.
The pain and anxiety, the pain of depression, you know. That shows that progesterone, which is used for birth control, as you know, also has a side effect of suicide. And of course, that's used often with women who uh, take it for many. There are a number of reasons for taking it. One of them is actually in men for not men. They use testosterone. Yeah, but
Mhm.
then of course steroids, which is an interesting drug that all transplant patients take for at one point or another. They may not take it for long, but most of them have to be on steroids to some extent. And it does have a side effect. And we've had a number of manias and psychosis and delirium, but they were often transient or temporary. And then after putting patients on medication and lowering the dose, it usually went away. But it's one of the many side effects of steroids.
Tatum, wasn't one of your treatments prednisone? Did you have that? Prednisone?
Most of the transplant patients, about 90% of transplant patients have prednisone at one time or another.
Mhm.
Yeah, I'm still taking that. Yeah.
Usually it's associated with higher doses of prednisone. And after you get transplanted, you're on a high dose, but you taper it down to a low dose. Usually doses under 10 milligrams are not associated with that, but the higher doses of steroids are associated.
Yeah.
Now this is surprising in some ways because you never guess what is #1 most debilitating disease in the United States, and you'll get the answer. Any guesses before we get to the answer? Well, think about it. Huh?
Okay.
Anybody want to?
I was gonna say dementia.
Arthritis. Mhm.
What'd you say, Dennis?
Arthritis.
Arthritis. Mhm.
Dementia.
Dementia. Interesting. Well, let's go down and listen. We'll see who's at the top of the list. It starts at the bottom and goes to the top. And they're talking about neurological diseases, which,
Wow.
as we know, the older you get, the more likely you are to have some of these neurologic disorders.
One of the first ones.
Cost of dementia and stroke will amount to $600 billion by 2030. Isn't that amazing? 600 billion.
Yeah.
And that's for neurological diseases, which they consider dementia and stroke in that category.
My goodness.
Doc, I heard they have a new drug that's is it efficacious for dementia? It's good.
I don't believe that. I have to see that. When you get that article, send it to us, because there's no drug that we know of that is effective, in spite of all the publicity,
It's
in
brand
spite of
new.
all of their claims. When they do double-blind studies, none of them have shown to help with dementia. So if you get one, now a lot of them say they're promising, and that's because they haven't used them in they haven't used them in humans, and they haven't used them in high dose, and they haven't done the double-blind studies necessary. There are some, and I don't know if Daryl's aware of products that are really effective to some degree with dementia. Daryl, you know of any?
No, I don't.
And you hear all these allegations and promising notes, but when push comes to shove, we don't have anything yet. So,
I'll check it out. I just heard about it last week.
yeah, well, yeah, that's it.
Something new.
Yeah. And then, of course, the endocrine disorders, of course, metabolic syndrome, which is a syndrome consisting of high cholesterol, high blood sugars, and high blood pressure, which is devastating. And a lot of it is related to obesity.
Mm.
Next is the musculoskeletal disorders.
Oh.
And of course, bone and joint diseases, which bring to mind the arthritis that somebody mentioned.
Yeah.
Arthur, is, as you know, is very, very common, and as you can see, it's number 5 as we progress down the line to number 1. And it gives you some ideas of what you should do. Stand up, sit up straight, engage in back strengthening. Excellent. Now, standing, sit up straight, people say. But that requires you to do exercises
Yeah.
and avoid heavy lifting and bend your knees. And then last, but perhaps most importantly, maintain a healthy weight and diet. That's probably the most important thing. All the others matter. Then, of course, accidents.
Oh,
They have this something that really causes most of the deaths in the elderly are accidents. And of course, in the very young, the two extremes, very old and very young, accidents are prime cause of death. Then we're getting close to the top, circulatory diseases, heart attacks and strokes.
Yeah, back to accidents, it says choose sidewalk over roads when walking.
where is that?
Choose the sidewalk over the road when walking.
Oh,
Yeah, but it's, when you're running, it's
Uh-huh.
choose the road over the sidewalk.
oh, okay.
Because tripping on the cracks in the sidewalk, the number 1 cause of runners' injuries.
Sure.
Oh,
You know, one of our doctors died from that. He tripped over and broke his neck.
oh, God.
One accident. Welcome back, Ms. Davis. We missed you.
I like the swimming lessons.
Yeah.
I waited till I was 50 to learn how to swim.
Really?
Yeah.
Oh,
Not on purpose, but I wanted to be a diver, so I had to learn how to swim.
You know, my father has about 5 or 6, 7 gold medals in swimming, and he didn't
Right.
start until
Yeah.
he was like 72.
really?
Going back to the sidewalk, I've heard, and some people have told me, that the impact of walking is better when you're on the street than when you're on the hard concrete, especially if the street is asphalt. Has anybody
Because of
heard
the
that
knee.
before?
Yeah, that's because of the knee, yeah.
Well, it's minimal. Actually, the sidewalk concrete is harder than the asphalt. And so it's a little softer surface, but it doesn't make any difference if you're walking. It'll make a difference if you're running.
Yeah,
And
you're right.
And usually the streets are more level. I used to walk a lot in my old neighborhood, and I preferred the street because the sidewalks sometimes are hilly, possibly due to trees and the roots going under or just cracks. It felt easier on your feet walking in the street. It was more level.
Except for if you're walking where there's a berm, the road is cambered usually when you're walking in the street, and so it's not level. And you're walking long distances, you can get some knee-related problems from one leg walking shorter than.
Wow.
Circulatory diseases are, and we're getting real close to the top. This is this is a big problem. And of course, we know that the role of healthy diet and exercise in that. And also, we sometimes don't talk about getting enough sleep, but sleep plays a major role. We still haven't gotten an answer to Chaplain Thorpe's problem of 12 hours of sleep, but anyway.
Yeah.
You still sleeping that long?
Yeah, since this coronavirus now, so I sleep about 8 to 10 hours.
Oh, we're back close to normal,
Lucky you.
Yes.
huh? Can you imagine? Yeah. Then cancers and tumors next to the top.
Oh my goodness.
Now, any other guesses about what's number one?
Heart disease.
Huh?
No.
Arthritis. Back to Janice.
No, we passed arthritis already.
Oh, I don't know.
Okay, here it comes.
What? Oh.
Oh, wow.
Mental
Okay.
health disorder.
Mm-hmm.
Yeah, I was about to say that because everybody's crazy except me.
Especially in DC.
Hey, Tatum was close, but he said dementia. He didn't say mental health disorders.
Yeah.
One could argue that that's in the same category, but actually they consider that neurological disease.
No, I think this may explain what's going on in the White House.
Exactly.
Ooh.
It's COVID related.
Oh my goodness.
A question, will they keep him there if he has a mental breakdown and he really exhibiting signs that he is mentally incompetent, which he has been? Will they ever say anything to protect the United States?
No, I think the Republicans will always support him as much as they can.
But isn't there some doctor or somebody somewhere will say that he is mentally deranged?
They've said that, they've been saying that for the last 2 years. But they can't do anything about it because his doctor doesn't agree.
Right.
His niece says it too.
What's that?
His niece wrote that book.
Oh, yeah. Yeah, well, other than the egomania, I didn't think there's anything else wrong with it.
On this regard, I like to bring up a question that I like to make a statement. Last week during the meeting that we had, I said, Joe Biden will be our president.
Sure did.
One of the ladies said, how do you know? Was that you, Janice, who said that?
No, because I was praying for him. I'm glad it worked out the way it did.
Okay, somebody said that. One lady told me that. And, you know, and I called Dr. Callendar and told him, and I thanked him for standing beside me. Why I thought he will, I said he will be. It's because of my faith that I have in God.
Yes.
I was looking back on the tape that Daryl sent me that showed you standing up for that.
Yes,
I was amazed.
I wanted to read, you know, it's in the Bible. It says Christians have faith, but some, however, have the spiritual gift of faith, which is an unusual measure of trust in the power of God. And my prayers and everything, because of that, you know, God had showed me, the Holy Spirit led me to believe that Joe Biden will be the president of the United States.
Now you have to
Whoever
convince.
asked me, how do you know that? I don't know who asked me that question in the meeting, but I thanked Dr. Callendar for standing up for me. He said, it's the faith, you know.
Well, it's too bad that Trump hasn't figured it out yet, that he's not president. He's still fighting it.
Oh my gosh. And he didn't say a word yesterday at the veterans, you know, for the unknown soldier. He just walked quietly.
What else is there for him to do? Do you think he will ever turn over the presidency voluntarily?
Not until the end. And anyone who works in the federal government, and I did for 37 years, and I always worked directly under the Secretary of Health and Human Services, this is transition time. They are supposed to have that key. The offices are set up, and GSA refuses to let them into space. Now, this is crazy. This is unprecedented. It really is.
Very sad, very
sad. Do you think he will show up for the ceremony in which he turns over everything?
Of course not.
I don't think so.
I don't think
so.
No. I think
so.
I hope he does. I hope he does.
Except for to interrupt it.
Has this ever happened before?
No,
Not that I know of. No.
Not in my lifetime.
Right.
Are you
Not
talking
that I
about the
know of.
inauguration?
Yes,
Oh,
Mhm.
okay. Yeah,
yes.
Very
Yeah.
sad. Very, very sad.
it's embarrassing.
I
Yeah.
think
Yeah, it
official
is.
or unofficial, there will be people down on the mall, hundreds, thousands.
Oh,
It just won't
yeah.
be an official inauguration. I think officially, due to the pandemic, they're going to have to say no due to distancing and whatever. So it'll be interesting to know what's going to happen in January.
Well, you'll have an inauguration ceremony. It's just a matter of who's going to be there.
Yeah.
Yeah.
Not like the marchers, the largest group, of course, was Obama. But then again, Trump said his was the largest.
I hope Trump shows up for the inauguration, though. That will be the
Yeah.
right thing to do. That's the right thing.
Yeah.
Well, he may be the first president not to, so it'll be interesting.
Yeah, it'll be interesting. We should see.
What is even more interesting is how his people will support his position.
Yeah.
I do think it's
Because-
dangerous to attend the inauguration because he's going to have some protesters out there and they may be armed, and so the shooting may start.
I think so, unless things change between now and then. He incites violence, he does.
Yeah, so it may be good for him not to show up.
I think you're right.
Well, this is an article on, people have said, well, I have big bones, so I need a different exercise, and I have small bones, I need a different exercise. This is an article that talks about the body types and how exercise can be catered to those people who are different body types. One of the few articles that actually does that. Ectomorphs, mesomorphs, and endomorphs. That's how we've characterized them. There are those for whom it's so easy to gain weight because they don't eat much and their basal metabolism rate is very slow.
Yeah.
Whereas those people who have basal metabolism rates that are very fast can eat a lot and not gain weight. That's the ectomorphs.
Doc, do these roles, can they change as you age?
It seems as though that's the case because many of us seem to be ectomorphs when we're younger. And when we get older, we become endomorphs. We get big and gain weight. So it seems as though we do. It seems like you really have to work at it. The older you get, the more you have to work at it. Dal didn't get slim by just genetically. He did it by working at it. And so as you get older, it's easier for you to gain weight. And there are some people who, no matter what they eat, they don't gain weight. And it's interesting. But it's clear that as you age, it's much easier to gain weight, and you have to work at it to stay at a good, healthy size. Any other questions about exercising? And we've talked about exercising ad nauseum, recognizing that a minimum of 150 minutes per week is the minimum, and 40% of the country exercises to that minimum. Only 40%, so 60% do not. How many of you exercise more than 150 minutes a week?
I do.
I do.
So most of us
Yes.
still don't, huh?
Yes, I do.
So it's something to look forward to because as you get older, I believe that after the age of 40, you need to exercise.
Yeah, that's true.
Hey, what's up?
Okay. Now this is an article that talks about foods you didn't know could cause
I'm on
obesity.
the transplant support group.
And
you just get on.
I guess, as you know, we've talked about that a lot. And I guess the one food that they can't talk enough about is sugar.
Yeah, that's true.
And that is loved so much by so many. But it's clear that sugar is dangerous to our health.
Right. Mm-hmm.
Do you eat any sugar, Darryl?
No,
You and honey, right? Is that it?
no, I don't eat honey.
Not that either. Okay. Anybody else doesn't eat sugar at all?
I'm
Yeah,
trying not to.
You try hard not to, huh?
I'm trying not to.
Well, when I say I don't eat it, I'm talking about cane and beet sugar, and things like honey or syrup, maple syrup. But fruits, I eat 6 servings of fruit a day, and so I get natural fructose.
Yeah.
Not nearly as sweet as the added sugar, as table sugar.
Yeah, but the problem is, stuff like oatmeal. I don't want fructose in my oatmeal. I want sugar.
Me too, John.
Well, we pay for it. That's all I can say. Now, this is surprising to me that there's so much in ketchup, so much sugar in ketchup.
I know.
I had no idea.
There's more sugar in ketchup than ice cream.
What?
That means I can have ice cream?
No.
That's not what he said. But that is incredible. I had no idea.
I can't believe
That
it.
is news to know.
Flavored milk is not a surprise, but
Yeah.
ketchup was a surprise to me.
Mm-hmm.
Yoga, I guess we've all known that yoga has a lot of sugar.
Yeah.
Even with the sugars, to me, it's not
Granola.
that sweet. Granola, that's a surprise as well.
Yes.
Oh, my goodness.
Don't they have yoga with no sugar in it?
Not that I know of. Do anybody know that yoga doesn't have sugar?
One of the worst forms of granola is trail mix.
Oh, really?
Yeah, trail mix, it's supposed to have raisins, berries, granola, and so, but they soak it in sugar. And when I was eating 2 bags of trail mix a day, that's when I went up to my high weight of 245, which is 70 pounds higher than I am today. So trail mix, it's even worse than ketchup and ice cream.
And I love trail mix. I love it.
And I love ice cream.
Me too.
And I hate ice cream.
Me too.
Oh, really?
Yes, I love ice
I
cream.
don't like ice cream.
Darryl,
It's weird. I like ice cream when I'm on the beach. But to sit down at night and have a bowl of ice cream, never. When I go to the beach, give me ice cream cone.
Really?
I'll go all year and not have ice cream.
bless you.
Nutrition bars. Now, I thought,
Yeah.
I don't eat any of them anyway, but I didn't realize they had so much sugar.
Ooh.
Canned bean, no wonder I like those beans. Added sugar, huh? That's it, huh? And beans are generally good for you.
Yeah, they are.
Yeah, among the best nutritional foods there are, but
What
we're
type
talking
of
about
beans?
canned beans.
Yo,
No, canned beans.
Like
Canned
baked
beans.
beans.
All, the other beans are good. It's just canned beans.
Like pork and
Like-
beans.
I don't do canned beans.
Dried beans are the best. Black beans followed by
Right.
Mhm.
Mhm.
Like black eyed peas.
Yeah, black eyed peas are good.
Mhm. Mhm.
But it's the canned product that tastes so good, beans that aren't have so much sugar.
Oh,
But there's little question that sugar is thought to be the one product that is associated with cancer and poor health.
If it's in a
If they
can,
look back at all of the products, the one that is most harmful, they think, is sugar.
if it's in a can, it's got lots of salt for preservative.
yeah.
I was going to ask about that too, because I think last week I mentioned that there's a lot of hidden sodium in a lot of products that you wouldn't even think about, like milk and cereal and beans and soup. I mean, there's a ton of sodium as well.
That's true. But I don't think, it's interesting when they look at, those are the two of the products that are thought to be most harmful, sugar and salt. But sugar seems to be number one.
Really.
Yeah.
I stopped using the granulated sugar, and I switched. I mean, you know, and it's weird. I bought a whole pound bag of sugar, and it's just sitting there. Only time I really use it is in my coffee, and I've switched to honey.
Hmm.
So
Okay, that's healthy.
healthier than sugar, yeah.
Yeah.
All right, here we go.
Oh, yeah, this is.
Now, it's interesting that we talk about God's mercies, and in many ways, this
Yeah.
may be one of God's mercies in the sense
Amen. That's right.
that we have a potential of having a vaccine
Mhm.
earlier than ever in the history of mankind.
Yeah, oh,
And
boy, thank you.
and that it turns out it is 90% efficacious in early results. Time will tell, because by November, I'm sorry, by December, we should have all the results in. These are just the early results. And by comparison, how effective do you think the flu vaccine is?
60%.
About
75.
50, right,
It's
about
like, is it like
55 to 60%.
40%?
What?
About 55% effective. What is the most effective vaccine, you think?
Polio.
Measles.
Smallpox.
Mumps.
Smallpox, yeah, I think so too.
Measles, 97%.
Oh, wonderful. Wow.
Yeah. But 90% is great. The flu vaccine, as he said, is 55 to 60% effective, and 60 is high. 55 is more like it. But so to have one come in at 90% effective is good. I don't think anybody anticipated it would be this good. Of course, they mentioned that they have a new technique, and of course, this is by far the fastest we've ever had a vaccine. So there are many disbelievers. And they want to wait until they see all the results in before they credit it. And FDA will see all the results first before they. Now, the one thing that Trump did, and let's give him credit where he deserves it. He paid for all the vaccines, so you can get them free.
Oh.
That's something that he did that was
Is
desirable.
that including the one now that we're talking about? Because
Say
it
what?
seems like, does that include the Pfizer one we're talking about now? Because they were talking something about that Pfizer wasn't included in the warp something, whatever he came up with, or something
Yeah,
like that.
but that doesn't mean that the country can't buy it from them, and they have already paid them billions of dollars for it. They were part of that original group that got grants to do it, but the government has already paid money so that any vaccine that they make and they distribute will be at no cost to people.
Oh, that's
That's
good.
nice.
It is free, but
So give Trump credit for something.
It's free. There's no distribution plan.
Yeah.
So good luck getting it.
Well, that's the proof of the pudding is in the eating of it. And they talk about some of the down parts of it. There is a vaccine that doesn't require all of the freezing
Yeah.
that this requires, but we'll wait and see what kind of results come from all of these vaccine products. And the distribution will be interesting to behold, to see how they stay true to the original distribution plan, and see if there's any situations in which dollars trump everything else.
Mm-hmm.
But it's going to be interesting. Any predictions?
I'm hoping to get a vaccine maybe in December. I'm hoping.
Springtime.
How would you manage to get it?
Because I'm 70.
Yeah, age is one of the factors, and being a healthcare deliverer is another factor.
Oh, in fact, 71. I'm sorry, 71.
Yeah.
Happy birthday.
Those people who are immune suppressed, they might get it.
Yeah.
That depends on a number of factors, right? Age is, of course, number one.
You know, I just saw a disinformation video where this lady was saying that the vaccines, the RNA vaccines change your DNA, and they add a metallic ion to your DNA that causes you to pick up 5G radiation. Unbelievable. And this is a doctor. I mean, I saw it yesterday, and once she started talking, I had to cut it off because it's stupid. But
well, you know, it's amazing how many people are against vaccinations in general.
I know it is. Mm.
Well, the good news, the other thing about this vaccine is that 42% of the people who are vaccinated were older and ethnic minorities.
Oh, wow.
So the usual problems we have with vaccinations and trials were not present with this group, because 42% were ethnic minorities, which is
Wow.
it's a good thing people have complained about it, because they took greater attention. It was interesting because I was telling you about my niece who was part of the vaccination group, and she tried to get NIH to use her, but they wouldn't. But she was used in another group, GW, and it was interesting that a lot of people tried to be used, but were turned down. So, but anyway, 42% is a good percentage.
Yeah, it is.
did those volunteers get paid? Do you know?
I don't know. I didn't ask him. I didn't ask my niece. I'll ask her now that you mention it. They always have some incentive, but I don't know what that incentive was. I'll ask her.
My question is, after they get the vaccine and it's 90%, effective, will people immediately stop wearing masks, or will they graduate down and continue to wear their mask?
Well, they haven't done that now, so I don't know. You should, because the entire United States will not be vaccinated until maybe sometime in the summer. So there's every reason to continue. Now, after you're vaccinated, after you're effectively vaccinated?
Yes.
And the vaccine is 90%?
Yeah, that'll be hard to get those people who are vaccinated to wear masks.
Dr. Callendar, I also hear that when they start giving out the vaccine, they're going to first give to the first respondents like doctors and
Yes,
scientists, nurses, people who
right,
work in the hospitals.
right.
Mhm.
Yeah, that's number one. You're right.
Yeah, that's the priority, they said.
Yeah, ought to be. Yeah.
Yes, it should be. Mhm.
Pearl Freeman is on.
That's right. Hi, Pearlie. How are you?
Hi, how's everybody?
Hi,
Good.
Pearl.
Surprising to see you without a mask.
Well, I'm home now.
Yeah, good. Okay.
Yeah,
Uh,
having some
now,
computer problems.
what is Trump going to do now that he's not been reelected? Is he still going to fire Fauci?
What he said.
No,
He's not. He said if
He'll
he was
try
going
to.
to be reelected,
no, he will not.
but he's not reelected. So, what does that mean? It's interesting.
You can't put anything past him because he's getting ready. It's like a kid. He's getting ready to tear up everything because he can't.
No.
You know, he's firing all these people from Pentagon and everything else.
I know.
Yeah.
And
he's
didn't they
fired.
say too that while he's president, New York can't get him? I thought New York had a lot of charges against him, but because he's a sitting president, there was nothing they can do.
Yeah,
Well-
as soon as he's down, he's going to jail.
He's going to jail. Yeah.
Unless he moves to Canada or someplace. I don't think Canada wants him.
No.
So he should go to Russia.
That's probably why he wants to stay in power so long. So he won't go to
Absolutely.
jail.
Yeah.
That's probably the
Stay out
main.
of jail.
Kevin is on the phone. Kevin S.
Yeah,
Oh, Captain, at last.
John invited me.
We missed you.
Hey, Kevin.
Hi, Kevin.
Hopefully my screen is blank and you're not seeing the bed head and the pajamas.
Yeah.
How are you doing?
I'm doing okay. Getting ready for I have a doctor's appointment today to draw blood.
Okay. All is well so far, huh?
Pardon me?
So far, so good, huh?
Well, I have a new doctor at Hopkins, so they're putting me through all sorts of tests.
Okay. Any comment about the battles with the scientists and the
Hey, Dr. Callendar, do you think that Biden's team will be consulting with Fauci?
yes. Yes, that's what he's predicted. Yeah.
Yeah.
Do you think he would hire him to be on the team?
I don't know because I think they should, but
I do too.
they released the information, but I haven't seen it yet in terms of who his team consists of.
The names that I've seen so far didn't include Fauci, because I was wondering the same thing.
Oh, he'll be there.
He'll be
Oh,
there.
yeah.
Yeah.
Yeah, he'll be there.
Yeah, they interviewed Fauci on CNN and asked him, did he speak to Joe Biden after the elections and when he was picking up, he already picked up his coronavirus team. Then Dr. Fauci said, I would rather not talk about that and just focus on these injections.
That's the answer.
Yeah.
That means he has been consulted.
That's the answer right there.
Right.
He's
Well-
consulted, yes.
They're
What is
probably meeting in the bathroom, one in one stall and then one in and discussing topics. Got to keep it top secret here.
Yeah. Well,
What about this, Doc?
Oh my gosh, this is horrible. Woo.
What?
Terrible.
it is kind of it's kind of bad to see the president and interacting like that way. It's such a bad example for everyone in the world.
Yeah.
And they're just laughing at the United States.
Yeah. Yeah.
Yeah,
One of
so-
the things Biden said was, look at the legacy that he's leaving. Years from now, we'll think about this. We won't think about any possible good that he's done. This is crazy.
Horrible.
Yeah.
Horrible. Mm.
Yeah, so
You know, it's interesting that the comment you made is probably accurate because all of the good that he's done, whatever it is,
Yeah.
will be kind of lost because of his outbursts. And he has done some good things. It's just that the egomania has outshone everything else. Then, of course, Ben Carson tested positive. It's hard to find anybody in Trump's administration who hasn't tested positive.
Right.
And a lot of it is related to the way he strolled around without a mask.
Right.
So is he immune now? I mean, if you had coronavirus, I mean, can anybody say that he can't pass it on, even though he's
No. If you get well, then you're likely not to be able to get it again for 6 months. That's as much as we know because we don't have ability to monitor people much longer than that. So time will tell.
I'm kind of saying.
Hey, Dr. Callendar, what does this say for a medical doctor of Ben Carson's status to, walk around without a mask and be involved in all this and not adhere to at least what scientists have said regarding masks and social distances? What does this do to your medical profession? Do you think it?
Well, it doesn't do any more than Trump, the president of the United States, doing it.
Okay.
I mean, we have bad examples as the president and as Ben Carson, who knows better.
You're going to have to disinfect the White House.
Oh, yeah.
Yes.
When he leaves, we don't want our President Biden to get into all that White House coronavirus place without disinfecting it.
Well, isn't that amazing? We have 10 million cases in the United States.
Oh my gosh.
More than 50 million cases in the world affected by the virus.
Good gracious.
And the worst is yet to come because we're getting ready to go into the flu season. So
yes.
This just came in yesterday, Doc. I don't even know if I sent this to you. This came from Mayor Bowser.
And I think it's frightening. It's frightening because the question is, how are you going to celebrate your Thanksgiving?
Yeah.
They just had on the news report yesterday that they were chastising the mayor for traveling to Biden's, celebratory.
Wilmington, Delaware.
Right.
And she didn't take the precautions or do as she has been saying, telling everybody else to do.
Yeah, they got on her pretty good. Well, it's scary. How are you going to change your Thanksgiving practice? You gonna have your family in?
I'm trying to talk my daughter from not coming from Macomb, Illinois to come here. I'm trying to talk her out of it. She wants to come home for Thanksgiving. I think it gets back to, being in the city all by yourself and not having family members. And she says, Mom, I was just tested and she works in a detention center. And so she's tested quite often, but I'm thinking about those who are just so depressed and just think they got to get out, and I think that's where she is. I'm tired of being here by myself, no family. And I'm like, well, you're going to come home and with old folk and try to infect us? But I'm still trying to talk her out of coming. And I was telling Carol, she comes home, I'm like, go downstairs, shower, wash up, put your mask on, keep your mask on, don't come near me, we'll be distance apart eating. But I'm just trying to talk her out of not even coming for the Thanksgiving.
But
Yeah,
Sylvia,
think-
I was thinking of that, but us that have our living parents, do we stop seeing them?
Yes.
We don't have to stop seeing them through, Zoom and, telephone. And I mean, I'm just saying right now, it's just a different environment. And
Yeah.
this too shall pass.
Mhm.
It's way too dangerous to put their health at risk.
Yeah.
We're thinking about already not eating, with family at all, and just that afternoon just do a Zoom where everybody can see everybody and talk. I've got 3 different families. My family, my wife's family, and my friends. And we'll just do 3 separate Zoom conferences. And my wife wanted to have dinner, on Zoom, and I said, no, you're going to be eating. Why would you show people eating on Zoom? But then she said, okay, well, we'll have dessert on Zoom. So it's the same thing. People are going to want to eat.
Yeah.
I want to eat dessert, but. So I think we'll separate it out, separate the eating. Unfortunately, because that's part of what Thanksgiving has always been, having the family all together and enjoying a meal. But it's going to be different this year. Sure.
It's one of the loneliest times of the year. And I sympathize with your daughter. And I think it's great that she at least is going to be tested frequently, so that should she come, she at least won't be infective. But it's something that each one of us individually is going to have to make a decision about.
Also,
and especially when you got children and grandchildren,
Mhm.
it's an issue.
very much. Also, as a chaplain, people ask me, about what to do about this. I said, it's really not all that hard. We'll be over with this thing pretty soon. We're going to have vaccination and all that. Let us love each other and, just cook. And if you just husband and wife and eat, you read your Bible, pray. That's what it's all about. Every day is a Thanksgiving because God is giving us food to eat, where there are millions of people dying in the world, have no food. Children, they're starving. Asia, Africa, oh my God, So we should be, this is the time to be thankful to God and let us, and cook for your family. That's what I'm doing. I asked you, Dr. Callendar, last week. So I have grandchildren, and my children, I'm cooking for all of them. And what I'll do is on Thanksgiving Day, we'll spend 20 minutes on the outside in the driveway. I'll have all their food packed. They all will be there. And I have my, socialization there. And they can take all that food that they used to, chicken curry and pie and cake, enjoy it at home. That'll be really nice.
Good idea.
Oh, can I ride by and get some chicken curry?
What is that?
I said, can I ride by and get some chicken curry?
I cannot cook for everybody. I'm sorry. I'm cooking for more than 20. So I want to be honest, So cook for your family. Cook for the elderly people in your family, and take it to their house. But maintain the 10 feet outside. Stay outside, and enjoy them. Talk to your grandchildren. You met them. They have plenty of food packed. All they have to do is go home and warm it up and eat. Look at the happiness you get, what you did. That's the greatest happiness, is what you did for others to make them happy. And that you cooked for them. They didn't have to cook. And all of you are happy. And thank God that you have food to eat, because millions of people that day will be dying in Africa, Asia, in India especially, I know, and Africa, I know, for a bowl of rice, they die, So we should be thankful to God. Celebrate Jesus Christ.
Don't forget that this is one of the loneliest times of the year, and the suicides increase between Thanksgiving, Christmas, and New Year's Eve.
That's
So this is something to keep in mind.
Yes.
While all that is true, it's still true that it is the loneliest time of the year for many people because they don't have any families.
Right.
So
That's true.
keep that in mind
Yes.
as you make your own decision about what you're going to do about your family. One size does not fit all.
That's true. Yes.
Dr. Callendar, I used to get lonely when I was out at school at Indiana University. Sometimes I didn't come home for Thanksgiving, but I would always come home for Christmas.
Yes.
And the reason was because, we only had 2 days, off, basically, a weekend. And by the time I got home, it would be time to turn around and come back, So sometimes I didn't go. So it was almost like a ghost town when everybody left.
Yeah.
When you didn't, you didn't come back home to DC. You came to my house on Thanksgiving.
A couple times, yeah.
Yeah, you were covered. We had you.
Well, my brother, count your blessings. I didn't have anybody in this country when I was in college, and everybody was gone for Thanksgiving, Christmas. I couldn't go anywhere because I don't have family in America. Nobody at that time when I was in college. But you know what? I enjoyed cooking for myself, and thank God for the churches that they had services, some of them, Thanksgiving service, Christmas service, New Year's Eve service. I went for all of them and I was happy,
Well, I see your Notre Dame still doing bad things.
Yeah, this is,
I looked at that and I said, my goodness.
yeah, I was
Way of
going
spreading
nuts.
COVID.
Crazy.
So now they have mandatory testing. And you're talking about Thanksgiving. These kids are going to have to be tested before they leave.
See if you see any black people there.
Yeah.
Yeah.
They're
Got a
in
few.
there.
Yeah.
They have a few. They think they're integrated in their own family.
Look at the football team. The football team.
Yes, football team.
The football team is 60% black.
Right. That's
Yeah,
right.
that's just a team. I'm talking about that crowd.
We can see it, John.
Okay, but look, here's the real picture. Look at this.
Ooh,
Oh my God,
goodness.
that's
Too
terrible.
many. That's too
Worse.
many. Wow.
That's worse.
So, yeah. So what happened? I guess you heard the football team beat the #1 team in the country.
Right.
Game, and the kids just poured out.
So therefore, they spread COVID all over the place.
Yeah, most of them had masks on, but a bunch didn't.
From that picture, it didn't seem like most had masks on.
Well, look, you can see, yeah, most of them had masks on.
Some, yeah, yeah.
That's why I got this closer up picture. But this
Many
is
of the thousands who still on the field were not wearing their mask or had their masks turned down. Yeah.
Right.
Well, okay. Looks like we're done for today. So we have our meeting on Friday at noon tomorrow. And any other comments? Any closing comments?
Yes.